we have only 18 COVID patients in hospital. And total admission overall, 290 patients. Well, as you're aware, about a month ago, we were overwhelmed with COVID admission to this hospital. In fact, we were running at any day, 65, 60 to 65 patient that requires isolation. Now, when you have those numbers, what it does is it uses all your resources in terms of medication. It burn your resources in terms of manpower, especially nursing and medical staff, portering, every aspect of care that you can give to a patient. And as you are aware, COVID-19 patients that requires hospitalization literally need a sort of high dependency unit care. So it takes a lot of out of us. So during that time, because of the numbers that were coming in, we had to scale our operation down to dealing with emergency cases, only. Also, those patients that comes in hospital that requires treatment as an emergency basis, we try to expedite those care. And as from the cold side, what we refer to as our cold operative cases, we were concentrating on mainly the urgent cases. What do I mean by urgent cases? That involves patients with cancers that delay in their treatment could affect them adversely. So we concentrated on that. Now, over the past 2 weeks, we have gotten a break, and I would say that was good. Our isolated patients for COVID is just about 20, 21, 22. I mean, one day it went up to 28, and that trend is holding. So whatever was done, it must have been working. So I'm now looking at how we can now reintroduce, and we have started some of that as well, our elective procedure. What do I mean by elective procedure? I mean, in patient that requires surgery, but because it is not life-threatening and waiting will not cause an adverse outcome, we started to look at how we can assist to bring back those patients on stream to treat them. And that is what we have been looking at over the past week. We have had discussions with the surgeons and the nursing staff and the anesthetists, which is very important in this. And we are trying to reintroduce to see if the numbers keep down, where we can get back to normal operating level with what we have available to work with. This morning, today is the 29th. Again, very pleasant for us. We have only 18 COVID patients in hospital, and total admission overall, 290 patients, and our capacity here is 342 patients. So again, this is giving me the green light that I can reintroduce some of our elective work and moving towards getting back the hospital to some level of our normal operations. And we are feeling very happy about it. So we are looking at our list, and I can tell you our waiting list for like gynecologic operation, eye operation, and some general aspect of general surgery like hernias, cholecystectomies. Those operations now are the ones we want to reintroduce. But I want the public to understand that we are going to do it now on a phase basis, and they should be patient with us because our effort is to try to reach to them. So I mean, in the past when I've announced this, they would flood the clinic and demand that they be placed on a list. I'm going to ask them to be patient. We have instructed to do it in a systematic way. And as I said, if the numbers stay down, I don't see a problem in getting this done. over the past month, I mean, because of the number of COVID deaths that we've seen, I believe people like know somebody who are close to them who die from COVID infection, and I think that the message is going across of the importance of taking the precaution as it relates to the masks and the distancing and to minimize the overgrowth. I believe the message is getting home to patients, and of course, along with other things, I think the shutdown has to do with it as well. I mean, it's sort of early to comment on those numbers, but I mean, in another, 2 to 3 weeks, we will see the effect of that as well. So something is happening, and it's happening in the right direction. The effect of the vaccine would be significant just yet because the numbers wouldn't be enough to analyze that. And we are hoping that once that is established, we'll even see further reduction in hospital admission, which is the key aspect of